as we try to seek some of the answers to these pressing questions. On to this now. Higher Health wants to ensure the safety of students and staff from COVID-19. It's conducting training for all higher education healthcare personnel, and that's to help control the spread. I'm joined now via Skype by Ramneek Ahluwalia, and he is the CEO of Higher Health, to tell us more. Tell us more about this program, Mr. Ahluwalia.
No, thank you very much. I think over the last 20 years, we had enormous challenges of epidemics like HIV, gender-based violence, mental health, unplanned pregnancies. That has always grappled our youth, have challenged our higher education or post-school education across our universities, TVET schools. And what we have learned is to engage this through a massive campaign with the help of our students. These are educated South Africans. We have in the form of student peer educators in them. We build an army of 5,000 peer educators every year. And I think considering that the president has asked for a solidarity plan, each and every sector must now utilize what their strength is. And I think the strength of higher education is education, capacity development, training, research. And I think we're going to use our strengths to now capacitate educated South Africans. These peer students who are available with us, who are who always fought these other epidemics with us. Now, can we prepare them to go back into those 2 million educated South Africans that are in the post-school education system across our 400 campuses across universities and TVET colleges? We can conduct through webinars. Fourth Industrial Revolution allows us to engage as far as with academia, to engage and explain and capacitate them through series of webinars. So the aim is, if we can galvanize youth, if we can galvanize our educated South Africans, can they go back to their families while they're in isolation? Can they talk to their students, or can they talk to their peer students or their family members? And can we have an authentic information, proper prevention information that can be then transmitted through an education methodology? And I think that's exactly where we're going to be pushing for going forward.
My sense here is that you are going to have a very intense program of education, albeit done via technology. But how quickly can you roll out these students then once they have been capacitated?
See, the point is we're going to start with the academics first. We've got a pool of 350 academics across our institutions, which is across 400 campuses, that assist us every time in mentoring students. And through them, if we capacitate them, we go further down into our student communities. We've got WhatsApp channels with student communities. We've got a link towards we engaging data partners like Vodacom. We're trying to use OBS, we're trying to use Teams, we're trying to use webinars, straight also in partnership with NICD to have proper, authentic capacity development trainings with our pool of educators that we have, both in the student community as well as in the community of academics. And the aim is that we need to reach our youth. The youth might not be extremely vulnerable when it comes to severity of the disease as per to the global data. We all are susceptible to this epidemic, but the youth can be the carrier. And we, being an immunocompromised country, or we elderly who are very susceptible, can be, this youth can actually transmit this virus quite immensely to the immunocompromised. So the responsible youth is very critical in this epidemic or in this pandemic outbreak. So I think that's the aim behind why we need to galvanize youth at this stage.
A final question to you. You are emphasizing the involvement of the youth, and let's put aside the student population for a moment. How do you rope in the youth in general? Because, as you rightly say, you identify them as possible carriers, particularly in a country that has a very weakened immune system with much of the population infected by HIV.
we've got, as higher education, we've got a strength called educated South Africans. If we can reach out to our 2 million young South Africans which are in the post-school education system, same mechanics we deployed for HIV or unplanned pregnancy, those epidemics that we have been fighting for years now. We reach out to them and we make them as change agents. They have families to go to. They are with their family members. They are with their peer relatives or family members who are school students or youth in the communities. We can move from an educated South African to our community. And the aim is to give authentic information. Aim is to provide proper, correct prevention information. This virus is very new to human mankind. Global data is coming on daily basis. Our guidelines are changing on routine basis. How do we reach out to them quickly? How do we inform them about this virus? We don't have a treatment, but what we know is prevention. Prevention is education, and education is how do an educated South African to reach out to his or her family. In this way, at least not all 55 million South Africans, but as far as possible, we can reach out to peer youth, we can reach out to family members, and somewhere we have a hope to engage this epidemic in that angle.
All right, Mr. Ramneek Ahluwalia, and he is the CEO of Higher Health, joining us via Skype from Centurion. Thank you very much for your time. Still to come, social grant beneficiaries continue to collect their monies today. We'll check how